So next we're going to be testing the motor innervation and the sensory territories for the median nerve. So the median nerve is primarily involved with supplying the flexors of the wrist and the fingers, as well as the pronation function of the forearm and the hand, and along with a couple of muscles in the hand that are critically important, one of them being the abductor pollicis brevis, the other one being the opponens pollicis, the so-called LOAF, L-O-A-F muscles. So we'll start with the more proximal innervation. Remember, the median nerve does not supply anything above the elbow. The nerve will travel, first of all, very close to the antecubital fossa, and then will give rise to branches that go to the pronator teres muscle first, and then to various flexors of the wrist and the forearm. So first of all, to test pronation, we have the subject turn his palm down, and we have him hold it there, and I forcibly try to overcome that, and I cannot overcome that. And this is because of strong action of the pronator teres muscle, which you can see here, as well as an important muscle in the wrist forearm area called the pronator quadratus muscle. So both those muscles pronate the palm down. You can relax. Next, we're going to test the wrist flexors. So I'm going to have him flex the wrist up, and this is really testing primarily flexor carpi radialis muscle. So bring the wrist in that direction here, straight up, and hold it strong. And he's got very strong wrist flexion with the flexor carpi radialis muscle. The median nerve supplies all the flexors of the fingers in terms of the sublimus function. So that's these four flexors here. So you can test them collectively. Have the subject pull the fingers forward like this, and you can try to overcome them, or you can test them individually. And really, with the sublimus, you want to test flexion at the proximal IP joint, and you can test each individually, like so, and then you want to test the profundus function, and the median nerve supplies a profundus function to the index finger, which is the distal IP joint here for the index finger, and then the middle finger, which is next tested. And you notice that when I test these profundus, I hold down the other fingers passively, so I don't allow him to use them to actively flex the finger I'm testing. So I hold those down and I have him flex the finger I'm interested in. So those are the extrinsic muscles supplied by the median nerve. In terms of the intrinsic muscles, the most important muscle is the abductor pollicis brevis. You give the subject a target, so have him come against your hand or finger, and now you have him come away towards another target, and now you're testing pure APB function by having him pull his thumb up against resistance towards the ceiling. Next, you test opponents by having him bring the thumb against your finger here, and you give him a target far away towards the hypothenar base. Hold it there, and I can't overcome him. Finally, in terms of testing lumbricals, it's really the distal IP joint extension. So you stabilize the proximal joint, have him bend his finger, now you have him straightened out. And you can see he can push me away by using his strong IP joint here with the lumbrical function. So that's the motor innervation for the median nerve. In terms of sensory innervation, the median nerve supplies the palmar aspect of the 3.5 digits in the hand, as well as the thenar surface of the palm in this area here. It also supplies a little bit of the extensor surface in the back, in the tips of the thumb, and the index finger, and the middle finger. But really, the important autonomous zone is this distribution here. So that's the tip of the thumb and the tip of the index finger. So that completes the examination for the median nerve of the hand.